Welcome to the deep dive. Today we're getting into menopausal hormone therapy, MHT. You might know it as HRT.
That's right.
It's a really big deal, this transition, menopause, lots of symptoms, physical, psychological.
Yeah. Come on.
And MHT, well, it's often the best thing for those symptoms, but gosh, the understanding around it has shifted so much.
It really has.
So our mission today, cut through that noise, give you the shortcuts to being properly informed, maybe some surprises too.
And it's worth saying, the impact of menopause goes deep. It's not just symptoms. It affects quality of life, relationships, emotional health, everything.
That's a really important point. So, okay, let's break it down. What are we typically talking about symptom-wise? What really hits women hard?
Well, they're the ones people hear about most, the vasomotor ones.
Yeah.
Hot flashes, like 3 out of 4 women get those. Night sweats, too.
Yeah.
Then there's genitourinary syndrome of menopause, GSM. That translates to vaginal dryness, sometimes painful intercourse. And the psychological side is huge. Brain fog, real mood swings, anxiety popping up, and sleep. Sleep gets really disrupted for so many. Insomnia, waking up constantly.
It sounds like one thing just piles onto another, a kind of negative cycle.
Exactly right. It's a cascade. You sleep badly because of night sweats, then the next day your mood is worse, the brain fog feels thicker.
And that impacts everything, work, relationships.
Absolutely. Daily life gets harder. Relationships fuel the strain. Even partner sleep can be affected,
Okay, so given how disruptive this can be, let's talk MHT itself. How did we get to where we are now? There was a big scare, wasn't there, back in the early 2000s?
2002. The Women's Health Initiative, the WHI study, the initial findings came out and, well, it caused panic.
What did they report?
Increased risks of heart disease, stroke, breast cancer.
Yeah.
And MHT is just plummeted worldwide. Doctors stopped prescribing, women stopped taking it.
But that wasn't the whole picture, was it?
Not at all. That's where the nuance comes in. Later analysis, looking much closer at the data, gave us the timing hypothesis. This was a game changer.
The timing hypothesis, what does that mean?
It means the risks were mostly seen in women who were older. The average age in that specific WHI group was 63. Or, crucially, those who started MHT more than 10 years after their menopause began.
Ah, okay. So starting earlier makes a difference. That's the window of opportunity people talk about.
Precisely. For healthy women who are under 60, or who start MHT within that 10-year window of menopause onset, the picture changes completely.
How so?
For them, the benefits generally outweigh the risks. We actually see data suggesting a reduced risk of death from all causes and less heart disease.
Reduced risk, wow.
Yeah. And another key finding often missed, for women who have had a hysterectomy and take estrogen-only therapy, there was no increased risk of breast cancer, possibly even a slight decrease.
That's fascinating. Okay, what about how you take MHT? Does that matter? Pills versus other forms?
Huge difference. Absolutely critical. When you swallow an estrogen pill, it goes through your liver first. That's the first pass effect.
And the liver processing it. That's the issue.
That process, unfortunately, increases the production of clotting factors. So oral estrogen carries a higher risk of blood clots, VTE, and stroke.
Okay.
Yeah.
But there are other ways.
Yes. Transdermal estrogen patches, gels, sprays applied to the skin. It gets absorbed directly into the bloodstream, bypassing that initial liver pass.
And the risk.
For healthy women, transdermal estrogen seems to have little to no increased risk of blood clots or stroke compared to not taking MHT. That's a really important distinction.
Got it. So MHT isn't just about stopping hot flashes. You mentioned wider benefits, this idea of health span.
Exactly. We're moving beyond just symptom relief.
Yeah.
Estrogen is fundamental for so many systems. It slows bone loss, protecting against osteoporosis. It helps keep blood vessels flexible, improves cholesterol profile, so it's protective for the cardiovascular system. And there's growing evidence for its role in brain health memory, potentially protecting against cognitive decline.
So using MHT appropriately could actually help women live healthier for longer. Not just live longer, but live better.
That's the concept of health span, yes. Extending the period of life lived in good health, free from chronic disease. MHT seems to be a tool that can impact some of the fundamental processes of aging itself when used correctly.
Now, with all this updated understanding, people might hear about other options. What about bioidentical hormones? They're often marketed as more natural or safer. What's the reality there?
Right, you see that marketing a lot.
Yeah.
The term bioidentical just means the hormone molecule is structurally identical to what the body produces. But the ones you often see advertised are compounded bioidenticals.
Compounded meaning?
Made up in special pharmacies. Not FDA approved in the same way standard pharmaceuticals are. And honestly, Those claims of being safer or better, they're largely unsupported by strong scientific evidence.
So there are risks.
There can be. Lack of regulation means worries about dose consistency, purity, potential contaminants. You don't always know exactly what you're getting or if it's the right dose for you. Standardized, regulated MHT is generally the recommended path.
Good to know. Are there any other sort of newer hormonal therapies being looked at for this stage of life?
Yeah, things are always evolving. One interesting area is GLP-1 receptor agonists, GLP-1RAs. You might know them from diabetes or weight loss treatment.
Oh, right.
Well, researchers are looking into their potential benefits for postmenopausal women more broadly. Things like weight management, heart health benefits, maybe even neuroprotection. It's still research, but they could potentially complement MHT or maybe even substitute parts of it down the line for some women.
Fascinating. So it really comes down to the individual, doesn't it?
Absolutely. That's the core message now. It has to be personalized. A shared decision between the woman and her clinician, looking at her specific health, her stage of menopause, her symptoms, her preferences, her risk factors.
No one size fits all.
Definitely not.
Yeah.
MHT is a powerful tool, but it needs to be understood and tailored.
So wrapping up, it's clear MHT is complex, but when we look at the evidence, especially around timing and delivery methods, it offers significant benefits for many.
When used appropriately, yes.
And maybe the final thought for you listening is this. Managing menopause well isn't just about tackling symptoms like hot flashes or poor sleep, as vital as that is. It's really about taking a much bigger view. Integrating these precise, evidence-based options like MHT where appropriate, alongside lifestyle, alongside strong communication and support, especially in relationships. The goal isn't just adding years to life, but adding health to those years, extending your health span, ensuring more vitality for longer.